Welcome to the Path to Better Sleep webinar. This is offered through the Department of Personnel and the BFIT and Wellness Program. My name is Kathy Hargrove, and I am the BFIT coordinator. So I'm usually a person who does not have any sleep issues. However, for the past 3 weeks, it's been a struggle. I have not been sleeping enough or sleeping through the night. So while I was having these problems, I was also creating this webinar. So I was utilizing tips that I was learning through the webinar to help me sleep better. And it did. After, I did review these tips and they did help me. So I hope that they help you as well. Later in the presentation, I will review what tips did help me in particular. So why is sleep important? 1/3 of adults report they do not get the recommended amount of sleep. Sleep affects almost every type of tissue and system in the body. Ongoing sleep issues can raise your risk for some chronic health problems like heart disease, high blood pressure. Sleep is involved in healing and repair of your heart and blood vessels. Sleep is also important for weight maintenance. Sleep helps maintain a healthy balance of the hormone that makes you feel hungry or full. When you don't get enough sleep, you may feel more hungry and you will eat more, so which could lead to weight gain. Adequate sleep is necessary to work safely and effectively, perform well in school. My daughter jokes that we are more worried about her getting enough sleep as opposed to her grades. But I've read that when you do not sleep well, the ability to learn drops by 40%. Adequate sleep is also necessary to fight off infection. Your immune system relies on sleep to stay healthy. Ongoing sleep issues can change the way in which your immune system responds. For example, if you're sleep deficient, you may have trouble fighting off common infections. Adequate sleep is necessary to support the metabolism of sugar to prevent diabetes. Sleep deficiency results in a higher than normal blood sugar level, which may increase your risk for diabetes. So reasons for poor sleep quality could be sleep disorders, health issues, unable to shut mind off, irregular sleep schedule, electronic devices, and nicotine and alcohol could also cause some poor sleep quality. I don't know if you guys can tell, when I picked out this picture, that was kind of how I was feeling the last 3 weeks, just not getting enough sleep. I think this picture just spoke to me when I saw it. I kind of laughed too. But there could be a number of reasons why you are not sleeping well. These could be temporary or they could be long-term. So are you getting enough sleep? So teens should get 8 to 10 hours of sleep per night. Most adults, 7 to 9 hours. And 65 and better should be getting 7 to 8 hours of sleep. So tips for better sleep. Just a fun fact, on average, cats sleep from 12 to 16 hours a day. So most of the day they sleep. I didn't realize it was that much. So a good tip for sleeping well is to create a sleep environment. So my husband just has never really slept well. So we have created a bedroom oasis. So we have light blocking curtains, so that way the room is dark at any time of the day. Our lighting can be dim or it could be bright. Our bedroom is in the basement, so it is a little bit cooler. We're probably about 68, 69 degrees. We also have a ceiling fan just in case we need to be even cooler. We've also purchased silk pillowcases, soft blankets. We have plenty of pillows. We have a comfortable bed. We actually upgraded from a queen to a king. And we also eliminate the clutter in our room. That's probably more so for me than him. I don't want to see the clutter when I'm sleeping. It kind of makes me stress out a little bit. But those are just some things you can do for your room. But to create a good sleeping environment too, you can create a bedtime routine. So this could include relaxing activities like a warm bath or shower, reading, meditation, or maybe even having a mini spa every night. You know, it could be a facial or painting your nails. You could also, as part of the routine, just prepare for the next day. Get your lunch ready, set up your coffee, breakfast, pick out your outfit. They also recommend turning off all your devices about 1 hour before. So this means cell phones, TV, tablets. And they also recommend avoiding caffeine six hours before bed and alcohol 4 hours before bed. So some sleep hygiene practices you may want to implement. Get outdoors. Getting bright light during the daytime strengthens your biological rhythms that promote alertness during day to help you sleep at night. Exercise regularly, or if you don't exercise, maybe just get up and move throughout your day, but try not to exercise 2 to 3 hours before your bedtime. So bed should only be for sleep. I know I read about during the pandemic, people staying in their PJs and maybe staying in their bed and working and eating. But let's get back into the habit of bed is just for sleep only, if you're doing that. And keeping a regular sleep schedule. So going to the bed at the same time each night and waking up at the same time each morning is a good habit to get into for a regular, for good sleep. However, on the weekends, I've heard two different views on this. Some say to keep your same schedule as during the week, but others say too that it's okay to sleep in on the weekends and especially to catch up on sleep that you may have missed during the week. So on the weekends, really up to you as far as what's going to be best. And also avoid large meals close to bedtime. I know I've eaten too late and it just kind of sits in my tummy as I'm trying to go to sleep. But also avoid foods that may cause you issues. Like, for example, my husband can't eat chocolate after a certain time of night. Tips for falling asleep. Relax your body. Now, when I read this, I'm like, well, that sounds silly. You should just naturally be relaxing. But I realize that I am not relaxing. I'm kind of tense when I'm trying to go to sleep. I have no idea why. And then I just have to tell my body, relax, sink into the mattress. So that's something too that you may want to look at. Also, playing mental games in your head. When I used to teach step aerobics, I would go through my choreography for the next day in my head. And for some strange reason, it did get me to sleep faster. Now, white noise is something you may want to implement. It will mask out other sounds. So white noise, a good example is like the humming from an AC unit or TV static. This noise can help you turn your mind off or induce sleep through relaxation. And also mind the 20 minutes rule. So if you've tried all these tips and stuff for trying to fall asleep, if you're still tossing and turning after 20 minutes, they actually tell you to get up, get out of bed, and try some relaxing activities. And then once you feel sleepy, return back to bed and try to go to sleep. Okay, here are some tips for staying asleep. Avoid alcohol. So alcohol may help you fall asleep. However, when the effects wear off, you may wake up later in the night. There's been plenty of times where I've woken up in the middle of the night, worried about something, and then it just keeps me up. But if we incorporate stress relieving activities throughout our day, it may be less likely that we wake up in the middle of the night because of these different stressors that are happening in our lives. And then if you're waking up in the middle of the night, check out your bedroom environment. Are you waking up because you're too hot? Maybe you got to set the AC lower. Are you waking up because something's flashing in your room? Just check out your bedroom environment to see what's waking you up. Do you have an overactive bladder? Are you having to wake up 3 or 4 times a night to go to the restroom? If so, that's something you may want to speak to your doctor about. And how is your mattress and pillows? They may be comfortable when you're falling asleep, but what if you're waking up in the middle of the night because your low back hurts or your neck hurts? So those are 2 things you may want to check out to make sure that you're remaining comfortable as you sleep. And then pain. Are you waking up from pain? Is this something that maybe you can counteract that pain during the day? Maybe massage would help. Or is this something that you needed to talk to your doctor about? Okay, so before we get into naps, I told you I was going to tell you what tips I did to incorporate with my sleeping. So here are a couple. So I was in a really kind of a bad habit. I would come home from work in late afternoon and have a cup of coffee. So that was one of the things I eliminated that to try to help me sleep better. Also, I was having a lot of shoulder tension, which was leading to my neck, and I was actually waking up because of neck pain. So what I started to do is give myself self massages during my workday. Just trying to, I was experiencing neck pain because on my computer. So I was trying to get up more and move more, also putting on a heating pad. So I was just trying to work out the kinks, and it has improved. My neck's not hurting anymore. And then when I was waking up in the middle of the night, I was just trying to relax my whole body again and sink into the bed. I did that one night, and it really did help. I fell back asleep. And then another thing that I really like to do is read my book before I go to bed. But guess what? My book is on my cell phone. So the light from the cell phone can actually interrupt your sleep. So that's one thing, too, that I had to take away. All right, so now we're going to talk about naps. So they're great to decrease sleepiness. They increase your concentration, increase your alertness, but they're best between 1 and 4 p.m. So they say about a 10 to 20 minute nap is pretty good refresher. But if you're sleep deprived, go a little bit longer. They say you can go 90 to 120 minutes. And just remember not to nap too late in the day. But also naps may be a great way to catch up on any sleep that you may have missed. All right, so when to see your doctor? So if your sleep issues continue, please see your doctor. If they're interfering with your daily activities, if you're excessive sleepy or tired, seek out your doctor, see what individual plans you can get to help you sleep better. Okay, so the final part of our presentation is I would like to take you through a progressive muscle relaxation. So what this is it's tensing and relaxing your muscles to bring a state of relaxation. And they also recommend this practice for falling asleep, or maybe if you wake up in the middle of the night. Go through the progressive relaxation. So just sit in your chair, nice and relaxed. So you can sit forward in your chair if you like. So bring one leg up, okay? And then you're going to bring your toe towards you. You're going to feel maybe some stretching through your calf, but we're trying to tense up those muscles. I feel this in my thigh and through my lower leg. And try to breathe as you're holding this. And relax. Let's try with the other leg. Up. Point your toe towards you. Hold that there. Continue to breathe, please. and relax. Awesome. Now, if we can squeeze our buttock muscles, just squeeze them. Squeeze them. How tight? It's really up to you how tight you squeeze your muscles. And relax. Every time I do, I feel like I really sink into my chair. Now, create an arch in your back. And bring your shoulders back. Create that arch. And relax. Now let's squeeze your upper back. So you can bring your shoulder blades back and just squeeze them together. You can also bring your shoulders up to your ears. Either one is good, but you're squeezing, squeezing, squeezing. And relax. Now let's squeeze our fist. Squeeze, squeeze, squeeze. Nice and relaxed. Now relax. Now bring your arms up like you're doing a bicep curl and then squeeze your arms. And relax. Now let's do one final one where you squeeze your face. Don't look at my face and laugh, but here we go. Squeeze it, squeeze it. Keep squeezing, keep breathing. And relax. So hopefully that did relax you as you're sitting in your chair. So you can do this relaxation technique throughout your day or at night to help you sleep. But this is the end of our presentation today. Thank you so much for coming, and I hope you have a great day.